My role is quite a varied role here at the hospice, which is why I enjoy it so much. So first and foremost, I'm a clinician, a doctor, which means I'm responsible for the medical care of our patients, both on our inpatient unit and also out in the community in their own homes. I also am responsible for managing our medical team, which is a team of consultants, specialty doctors and training doctors. And I also am part of our senior management team, which means I'm part of the team that help run the charity, and I'm involved in the bigger picture, thinking about whether our services are meeting the needs of our community, both now and in the future. As a team here, we're very much focused on the individual, treating patients as individuals and really trying to understand their story and what matters to them most. I think by doing that, we're then able to give them the best possible care. And I think our focus is on our patients, but also on their loved ones and that's the wider connections that they have, that the impact that we have as a team is greater than just that we give to the patient. I work directly with patients myself. So as I said, I will go out and see them on home visits in their own home. I might see them as outpatients in our clinic rooms, and I will lead ward rounds on our inpatient unit. That's part of the job I really enjoy, is that I still have that direct patient contact.
So today we're coming out on a home visit to see one of the patients we have on our community caseload. I've come here jointly with one of our nursing team, and we quite often do that joint working so that we can try and meet the needs of the patient, and asking them how they've been since we last met them, talking about their medications, thinking about how we might adjust things, and just seeing if there's any more support that this patient or his wife might need from us as a hospice. We know that the majority of people would like to stay in their own homes if at all possible towards the end of their lives. Often we're seeing people having to go to other environments where they really don't want to be, so it makes a huge difference to be able to come out and deliver that level of support. And we're really fortunate at the hospice that we do have doctors and nurses and counsellors and other therapists who can all come out and see people in their own homes.
Here working at St Wilfrid's, you really feel that you are connected directly to your local community, and I'm very conscious of our role as a charity and obviously the need as clinicians to help support the income generation that we need to deliver our services. It's really interesting in my role within the SMT, being able to sort of bring the patient voice into the room, but actually to work with the wider team to think about what our community needs from us. Today I'm on the ward, what we sometimes call our inpatient unit. This is where we have 14 beds to support people either with their symptom control or perhaps for an end-of-life care admission. We have a team of doctors and nurses who work here 24/7, and twice a week we have a consultant ward round where myself or one of my consultant colleagues joins the medical team and our future planning nurse and goes round and sees the patients in a little bit more depth to make a really clear management plan for their needs. As a consultant, that's one of the appeals of the job, is that actually I can work in both a ward setting and in a community setting, and also see people as outpatients. So there's a real variety of ways in which we can offer the support that patients need. On the ward we have our most complex patients. We ultimately have to work as a multidisciplinary team. We have a huge amount of expertise in this organisation, whether that be consultants, nurses, specialist nurses who prescribe, therapists, family support team. The system and our care wouldn't work if we didn't have all of those individuals working together. So I think sometimes people think we're here for the fluffy stuff, if you like, but actually there's a lot of real genuine expertise. When we're working on the ward, it can be quite intense at times. It can be quite emotional, sometimes quite overwhelmingly emotional, but I think we all work very much as a team and support each other. And ultimately what I think I pick up from being here is that there's always smiles, there's always laughter, there's always a degree of happiness around, even when we're working in such a difficult area.